Hello everyone, this is Alex. Today's topic is a simple basic anatomy of the heart and a systemic circulation. Okay, systemic blood circulation in the human body. So, let me tell you basic things. Okay, in the circulation and heart anatomy. So, what is the first topic is systemic blood circulation. Okay, systemic circulation of the heart. So before discussing this systemic blood circulation, we need to know about the heart anatomy. Okay, main concentration is on systemic blood circulation. So there are many circulations in the body, like portal circulation, systemic circulation, pulmonary circulation, fetal circulation, but mainly today's topic is systemic blood circulation. To know this, we have to know about the anatomy of the heart. Okay, so we know already. So I'm not good at drawing this, simply I will draw. So like this. So this is a simple diagram to understand. So this is a right side. This is a right side, and this is left side. Okay, this is the right side and this is the left side. So I think you may you will know the anatomy of the heart. So heart is having a total 4 chambers. So the top 2 chambers are called as a atria. Okay, and this is a right side, right atrium, left atrium, and bottom 2 chambers are called as a ventricles. Okay, so right ventricle and left ventricle. Okay, simple diagram to remember. Okay, so I will write this is a right atrium and left atrium, right ventricle, left ventricle. Okay, clear? So heart is made up of 4 chambers, is having 4 chambers. Upper 2 are atriums, lower 2 are ventricles. Okay, so and it is divided by the atrial septum divided by the septum. Okay, between the right and left atrium there is a atrial septum, and between the ventricles or ventricular septum is there. Between the right atrium and right ventricle, between the ventricle and atrium also there is a septum, is a atrioventricular septums will be there, divided chamber. Okay, walls will be there. Okay, so this is common simple anatomy. So but mainly in the systemic circulation, what we are discussing means, so how the blood is coming to the heart and how the blood is going from the heart, okay, to the entire body. So mainly in the systemic circulation, what is happening, the deoxygenated blood is coming from the all over body to the heart. Okay, so the deoxygenated blood is coming from all over the body to the one side of the heart. This entire right side is having a deoxygenated blood. In the childhood we used to study the pure blood or impure blood, like that. Impure means is nothing but a deoxygenated, means there is no oxygen in that. So here in the atrial side, okay, so this is a superior vena cava, SVC, this is IVC, inferior vena cava. Okay, by these 2 vena cavas, okay, big veins, okay, the deoxygenated blood from all over the body is coming to the atrium, right atrium. Okay, so it means from the all the superior body parts, all the above body parts, okay, from head and trunk and limbs. Okay, so the blood is coming into the heart okay, coming into the right atrium. Okay, this is called deoxygenated blood. Deoxygenated blood. Okay, it means there is no oxygen, means oxygen levels are less. So deoxygenated blood is coming into the right atrium. Okay, and same like that from the inferior body parts. Okay, from the lower body parts, again the deoxygenated blood is coming into the right atrium. So, okay, right atrium is having completely deoxygenated blood which is collected from the entire inferior and superior body parts. Okay, from this where the blood is going from the right atrium, so blood is flowing into the right ventricle. Okay, through a spot that is called, okay, here, so there is a opening will be there, so that is called tricuspid valves. Okay, so there will be a different valves in with the will be there in the heart. So here you will have a tricuspid valve. Okay, so through this tricuspid valve, so blood is coming from the right atrium to the right ventricle. What is the blood? Here it is deoxygenated blood again. Okay, from the right atrium to the right ventricle, deoxygenated blood is coming through the tricuspid valve. Okay, from here what is happening? From here again, so blood is going to the lungs. Okay, blood is going to the lungs. Okay, for the purification. How it is going? Again there is a, so always remember, don't confuse with the veins and arteries. Arteries always carry away from the heart. Okay, arteries carry the blood away from the heart and veins carry into the heart. Okay, so from here what is happening? From the right ventricular through the pulmonary artery. Okay, through the pulmonary artery, okay, so what is happening? It is going to the lungs. Imagine here lungs are there. Okay, so the lungs. Okay, so the deoxygenated blood is going to the lungs for the purification. Okay, here mixing with the O2. Okay, it get purified. It means it will turn into red color. Okay, here again one more valve will be there. Okay, at the pulmonary artery, so there is a so blood is going from the right ventricle to the lungs through a pulmonary artery. So I told you arteries always carries the blood away from the heart. Okay, okay, so through a pulmonary artery, blood is going to the lungs, and lungs, then there is a purification happen from the lungs. Again blood is coming to the right atrium. Okay, right atrium. After the purification, okay, the oxygenated blood is coming to the right atrium from the lungs. Here oxygenated blood. Okay, and from the left atrium, the entire left atrium is having a oxygenated blood. From the left atrium, again the oxygenated blood is coming into the left ventricle. Okay, left ventricle. So this from the left ventricle, again the blood is going to the, okay, so how the blood is coming from the lungs to the left atrium means through a pulmonary veins. Okay, by the pulmonary vein. So from the right ventricular, blood is going through the pulmonary artery, lungs, purification, then by the pulmonary veins blood is coming into the left atrium, from the left atrium, blood is entering into the left ventricle. Here again valve is there, like a tricuspid valve in the right side. Here you have a bicuspid valve will be there. Okay, and again here I forgot to tell you. So here one valve will be there in the pulmonary artery, that is called semilunar valve. Semilunar valves will be there. Semilunar, okay, semilunar valve, pulmonary artery semilunar valve will be there. Okay, and from after entering the oxygenated blood into the left ventricle, what is happening? So this purified pure blood need to be pumped to the entire body. So how it will go? It will go to the entire body by the aorta. Okay, aorta. So the big artery. So from here, so big artery will start. Okay, that is called aorta. Okay, aorta. Again here one valve will be there. That is also another aortic semilunar valve. Okay, so from here the blood is going to the, this is called arch of aorta. Okay, from the aorta it will go to the entire body. Okay, it will divide it into another circulation like coronary circulation system, another pulmonary circulation, portal circulation, all entire body it will supply from the aorta. So like this, how the systemic circulation is simple. So from all over the body, the deoxygenated blood is coming to the right atrium by the superior vena cava and inferior vena cava. Then from the right atrium, blood is flowing into the right ventricle through a tricuspid valve. Then from the blood is going to the lungs for purification by a pulmonary artery. So there is a pulmonary semilunar valve will be there here at the pulmonary artery junction. Then in the lungs, purification mixed with the O2. Then the oxygenated blood is coming into the left atrium. Okay, through a pulmonary vein. From the left atrium, again the blood is coming into the left ventricle. Okay, left ventricle through a bicuspid valve. Then from the left ventricle, the blood is flowing into the entire body through a big artery called aorta. Okay, there is again a valve called aortic semilunar valve will be there. So we have seen total 4 valves here in the between the atriums and ventricles, tricuspid in the right, bicuspid in the right, and there are other 2 semilunar valves. So one is at the pulmonary artery, another at the aorta. Okay, so what is the main use of these valves means these will stop the regurgitation. Okay, this will stop the regurgitation and reflow. Okay, reflow and overflow. Okay, these valves will be closed when the blood needs to be pumped from the atrium to the right ventricle. This valve will be opened, that is tricuspid valve. Then when the ventricles are getting contracted, when blood needs to be pumped into the pulmonary artery, then this tricuspid valve will be closed. Okay, and it will enter in, then the semilunar valve will be opened. Okay, it will enter into the lungs, then coming same scenario will happen. So there are some deformities or problems like mitral valve stenosis. All valves stenosis may happens. Mitral valve, okay, also called as a bicuspid valve. Okay, mitral valve stenosis or mitral valve regurgitation or tricuspid valve stenosis or a regurgitation. Okay, same like semilunar valve stenosis or regurgitation. All these malformations or deformities sometimes may happen. Or when sometimes atrioventricular septal defect may takes place in the children, or ventricular valve septal defect also happens sometimes. Okay, these are all the some of the common problems we will see. So, and one more thing, compared to the atriums, ventricles will be little big, and in the ventricle also left ventricle is bigger size than the right ventricular, and these ventricles made by the thick membranes or thick muscle. So because it needs to be pumped. Okay, and when the contraction and relaxation takes place, then only this heartbeat also produce. Okay, and another thing, BP. Okay, BP also, the systolic and diastolic pressure also, when the ventricles are getting contracted. Okay, when the ventricles are getting contracted, then the systolic pressure will be developed, and the when in a ventricles in a relaxing state, okay, then the diastolic pressure will be developed. So these are the some of the main important points to be remembered. Lub-dub sound will be produced by the contraction and relaxation of the heart. Blood is pumped by the contraction and relaxation. Systolic and diastolic pressure will be developed. And commonly, frequently asked questions like this valves. How many valves are there? How many semilunar valves? How many? Which side bicuspid valve is there? Which side tricuspid valve is there? One bicuspid valve also called as a mitral valve. Okay, and so how the blood is pumping? Okay, from which area to which area? All these come most frequently asked questions. Okay, thank you so much. In the another video, we will discuss with the some of the commonly asking questions related to the heart and circulation. Thank you so much.